Welcome to the Oxygen Alliance YouTube channel, where we bring you videos on installation, maintenance, and various trainings on oxygen equipment and devices. If you have comments and or questions, drop them in the comment section below or write to us info@oxygenalliance.org. Remember to like our videos, subscribe to our channel, and hit the notification bell.
Hello everyone, let me welcome you to our today's session brought to you by the Oxygen Alliance. So my name is Victor Nzende, a biomedical engineer with the Oxygen Alliance, and I'm excited to be your host today. I am hosting this call from Lilongwe, Malawi, where most of the engineering team for the Oxygen Alliance is based, and would like to know where you are joining us from. So you can do that by simply typing your name and location in the chat. And also, if you want to be added on our emailing list, please go ahead and type your emails in the chat as well, so that you may be receiving communications from the Oxygen Alliance. So in our today's session, I will feature a presentation by Engineer Philip Anyango, who is a consultant of biomedical engineering and also the Oxygen Alliance country lead based in Kenya. So he will be presenting on the topic, the ISO standards for medical equipment management. I encourage you, our audience, to note down any questions that you may have as he will be presenting. You can actually scribble your questions somewhere, or if not, you can just be pasting them in the chat. And at the end of the presentation, our presenter will gladly take your questions. So I think without wasting much of your time, right now I'll hand it over to Engineer Philip to introduce himself and take us through the presentation. Thank you so much. Over to you, Engineer Philip.
Good evening, good morning, everybody, wherever you're hearing it from. I'm Engineer Philip Anyango, consultant medical engineer, as Victor has told you, and also the Oxygen Alliance country lead in Kenya. I'm presenting from Kenya, Naivasha, Kenya. And I want to welcome you to the discussion of today, ISO standards for the medical equipment management. The objective of this webinar today, number one, is to understand the ISO standards relevant to medical equipment. Number two is to learn how these standards apply to daily work in hospitals and health facilities. And number three, to discuss practical approach to compliance and quality improvement. ISO certifications. These are international recognized standards developed by International Organization for Standardization. That is the ISO. They provide framework guidelines and requirements that organizations can follow to ensure quality, efficiency, and consistency in their products and services. Back the word quality and safety and efficiency, those are keywords that the ISOs are based on. The objective of the webinars is to understand the key ISO standards relevant to medical equipment, to learn how these standards apply to daily work in hospitals and health facilities, and to discuss the practical approaches to compliances and the qualities improvement. Why ISO standard matter in medical equipment? Number one is to ensure patient and staff through standardized practices, to ensure patient and staff safety through standardized practices, is to improve maintenance quality and documentation, support regulatory compliance and accreditation, and build credibility, that is to build the confidence and professional recognition. If you're doing things as per standards, you get respected when people see what you do is safe, efficient, and people can rely on it. The ISOs these are the ISOs that are involved in the medical equipment management. Number one, ISO 13485 is a medical devices quality management system. This ISO is the importance of documentation, traceability, and maintenance records. That is, it can trace with this, if you implement this ISO, you can trace the location of the equipment wherever it is, or wherever you can transfer from the time from the manufacturer, so long as you follow this ISO. If you are compliant to this ISO, wherever your equipment is, it can be easily tracked. How this standard supports internal processes for equipment services. It focuses on quality management systems specific to medical devices, ensures processes for procurement, for installation, for maintenance, for calibration, and disposal follow international standards. It is widely required by regulators for organization handling medical equipment. ISO 14971, application of risk management to medical devices. This ISO focuses on identifying, evaluating, and controlling risks to medical devices. This risk to infusion pump failures, it could be risks to say X-ray equipment failure, it could be risk maybe to electrosurgical unit failure. The risks that are, it is evaluate and control risks that are related to medical devices. And as you know, medical devices are those equipment that are directly used on the patient. It is applied in maintenance and safety checks to reduce patient and staff risks. It complements ISO 13485 by strengthening risk-based decision-making. Real-world examples of risk mitigation in maintenance and repair. We also have ISO 62353. It's for testing IEC, not ISO. IEC, International Electrical Commission. It is for testing of medical electrical equipment. This ISO gives guidelines for electrical safety tests after repair, which many occasions we test insulation resistance, how safe equipment is. We can even test leakage currents. Those are electrical safety. The difference between ISO 6061 type of testing, ISO 60601 is normally for equipment that are used, home-based equipment. And IEC 62355, there is for routine testing. It is for hands-on relevance. It is hands-on relevance for biomedical engineers during preventive maintenance. After you finish preventive maintenance and your compliance to this ISO, then your quality will be perfect. We have ISO TR 24971. It is a practical extension of ISO 14971, useful for technicians managing complex and older equipment. When the equipment has passed more than 10 years, and this ISO is very useful to you. It gives us tips for creating equipment risk profiles. Practical approaches to achieving compliance. Leadership. For us to, when you want to implement any ISO, call it ISO 17025, the first thing you do is to need to secure leadership. The management must understand what you must get the support from the leadership. You secure top management to buy in. Quality must be strategic priority. You define clear policies, roles, responsibilities, and accountability. Then you allocate resources. Then you do gap analysis, the baseline assessment. When we do baseline assessment, we conduct a gap analysis comparing current practices and ISO requirements. We identify strengths, we identify weaknesses, priority areas for improvement, and we develop realistic roadmap of implementation of the ISO that we are talking about. Documentation and standardization, we develop quality management system. The quality management system serves as a guide that outlines the organization quality policies and objectives, and also responsibilities. You ensure that the document control, versioning, access, and update. Document control, if you develop an SOP, it also have a control number. Then we understand the standard. If suppose you are developing ISO, you want to implement ISO 9001, you need to understand it, which is for quality, or ISO 13485 for medical devices, or ISO 17025, which is for calibration testing, calibration labs. You must understand it. You must train people so that they should know what it is or how it is supposed to be implemented and what are the requirements. You need to conduct awareness sessions so staff understand requirements, and you use gap analysis, assess the current practices against the ISO clauses, and so that you can be able to know where are the gaps. Then you carry out training and competence. Train employees on ISO requirements, procedures, and their roles. Provide job-specific technical training in like calibration, maintenance, and safety. You keep on training, then you implementation daily. And then after doing the implementation daily, you do audit to see where there are still gaps. And after doing audit, you can see where the gaps and see how to close the gaps. How do these ISOs, when we applying ISO standard across the medical equipment life, how does it affect, do we apply it across the medical equipment life? When we are planning for procurement, we align technical specification with ISO requirements. During installation and acceptance testing, we use ISO IEC 62353 to verify the operation. For routine maintenance, following ISO-based checklist and documentation practice. For calibration, we use ensuring ISO 17025 accredited calibration services are applicable. And when we're decommissioning, we do safe disposal in accordance with the risk management and best ISO practices. Implementing ISO standards in workplaces, I think I've discussed that. Implementing ISO standards in day-to-day work, if we implement, we're creating and using standard procedures, SOPs, keeping service and maintenance logs, ISO compliant, training technical staff on relevant ISO principles, preparing for audits and inspection using ISO aligned practice. That is when we're implementing, practicing in our day-to-day work. What are the common challenges and possible solutions when we are implementing the ISO? Number one, they are expensive. The cost of implementations are very high. You need to hire the consultants you need to do audits, you need to do training, and you need to do system upgrades. So how do you go about this? You start with ISO 19. You can start with an ISO which is lower in costs as in implementation, like ISO 9001, which is a foundation for others. With ISO 9001, what you need is a room for training. When you're doing ISO 17025, you need to build a lab, you need to equip a lab, you need to train people on the ISO 17025. Two is first certification 2 to 3 years to spread cost. Use internal experts, biomedical engineers, quality assurance officers as ISO champions instead of full reliance on consultants. Two, the challenge number two, resistance change. Really, human beings are resistant to change. Staff may see ISO process as a bureaucratic or extra workload. And how do you approach this? You conduct awareness sessions showing how ISO improve patient safety and efficiency. You involve the staff in developing SOPs so they feel ownership. And then use pilot projects, example, preventive maintenance tracking, to show quick wins so that they can accept it. Challenge number three, documentation can be a burden. This is one area which the biomedical engineer has an issue, including myself. I fix equipment and I come writing a job card becomes a problem. And you know, if you don't document, you have not done it. So ISO standards requires extensive policies, SOPs, maintenance logs, calibration records, etc. The solution is to implement a computerized maintenance management system to digitize records. You standardize templates, you use standard templates, checklists, calibration reports, and align a quality coordinator to oversee documentation. 4, limited technical expertise. Few staff are trained in ISO requirements, especially technical ones like ISO 13485, 14971, and 17025. That is 17025 for the calibration. The solution to reduce costs is to partner with the national standards bodies, professionals, associations, or universities for training. Cross-train biomedical engineers in quality and risk management, and you can use online courses, which are also cheaper and flexible. Challenge number 5, the time constraint in hospital. Hospitals are busy environment. Staff struggle to balance certification tasks with patients. The solution is to create a dedicated ISO team with protected time, integrate ISO tasks into daily workflows, e.g. calibration logs, fill during routine tasks, schedule audits, and training during low periods. Challenge number 6, sustaining compliance and post-certification. Some hospitals pass certification but later fail to maintain. With certifications, you need to be audited every year. And if you're audited and you don't comply, then you lose the accreditation. The solution is you conduct internal audits every 5 months, establish a continuous improvement committee, and tie ISO compliance to staff performance. Challenge number 7 is calibrating and testing ISO 17025. Setting up and accrediting a calibration lab is costly and technically demanding. So start with outsourcing calibration to accredited providers. Develop a gradual plan for in-house calibration capability. Use regional calibration centers if possible. Challenge number 8, asset management, ISO 55001. Hospitals often lack accurate assets registers and life cycle planning. So we need to begin with a baseline survey, baseline asset inventory, use low-cost asset management tools or CMS, train finance plus engineering team on total cost of ownership. In summary, these are the ISOs. These ISOs are the ones that we use in different areas. For the hospital, we use ISO 9001, ISO 14001, ISO 45001. For biomedical engineering departments, we use ISO 13485, ISO 14971, ISO 7396. Medical device manufacturer supplies, we use ISO 13485. Digital health, we use ISO 27001. I'll end there and open the floor for contribution and questions. Thank you.
All right. Thank you very much, Engineer Philip.
The floor is open to questions. I've seen a couple of questions in the chat. Yeah, of course, chat has said you have programs that can support biomedical engineers who want to become certified ISO trainers. Maybe the way you would take it, Philip, is that maybe are there any other programs that are available for biomedical engineers who want to become like ISO trainers on this?
Yes, there are programs like in Kenya. We have Kenya Bureau of Standards training on particular ISO, and also we have KENAS, the Kenya Accreditation Service. They also train on different ISOs. There are times that they are advertised when they are doing the training. So when you do the training and you pass the training, then they can examine you, and then you can be an assessor, an auditor, or you can also be a trainer with time after gaining some experience.
All right, thank you so much for that answer, Philip. I've also seen someone also wants to get a long form for CMMS. Maybe you could just explain a little bit about the CMMS that you were talking about as well.
MMS is the computerized maintenance management system. It is it's a digital platform where you will make your maintenance planning, and it will be able to alert you when a maintenance is scheduled. So when you have done the maintenance, you will report there all that you have done. And when you want to get a report from a click or button, you can click and say that you want to know how many maintenance you did this month, how many services you have done in this month. And it will help you also. You can even get the equipment history, what you did in that sort of equipment by the click of a button. That is the CMS. It also helps you in budgeting, and you can know what is the common problem with equipment easily by just a click or a button. It's called computerized maintenance management system.
All right, thank you very much. I know that people are asking for the PowerPoint presentation. Let me remind everyone that this PowerPoint presentation will be available on the BME Konza app. This is an app that was created by the Oxygen Alliance to create a platform where engineers across the region can come together, ask questions, get answers to the questions or the problems that they're facing in their facility based on medical equipment, and also get access to some resources like manuals and maintenance videos. So if you'd like to get access to this app, you can either go on Google Play Store, where you just search BME Konza and you will be able to log in to the app. The iOS version for the app is not available currently, but we're working on it, and I think it will be out in a few months or weeks to come. And also we are working on a web platform for those people who may want to use their laptops and the like to also be able to access the app. So this will be available on BME Quant app. And also the recording of this session will also be available on the Oxen Alliance YouTube channel. So for those of us who do not know, the Oxen Alliance has a YouTube channel where we have a lot of content in terms of the webinars that we conduct and also the maintenance videos that we do release twice every month. There's a question from Ronnie Otieno. I hope I've pronounced your name very well. He's saying, could be there any existing computerized digital systems that can help engineers and medical personnel to track the ISO standard? Could be there any existing computerized digital systems that can help engineers and medical personnel to track their ISO standards? Over to you, Engineer Philip.
Well, I don't know of any that's existing now, but I know of the one which is going to help you to be compliant to the standard.
So may you just please elaborate the one that you know, please?
It is the CMMS. It is to
Right.
be able to keep records and help you to keep records. And when you keep records, you'll be able to be compliant to the standards.
Great. So there's also another question. I am from Marine. She or he is asking, I don't know. I'm in Kenya. My only concern is the practicality of the ISO in Kenya.
Mm.
How do you rate the country on a scale of 1, that is the lowest, to 10 being the best in terms of how Kenya is doing? Maybe let me just also point it out that in as much as Engineer Philip is based in Kenya, but we also have our audience from across the regions. We have people from Malawi, Tanzania, Zambia, Nigeria, and all the countries that I've seen people pointing out. But this person is actually asking, how would you rate the use of these ISO standards in Kenya based on your experience, Engineer Philip? Over to you.
I think in healthcare system, let's talk about ISO 9001. I would rate that is really doing very well. Let's say in a 8 to 10, it is cutting across. You know, ISO 9001 is cutting across sectors. And when we talk about, we also ISO 17021, which is management. It is a management system, ISO, which is also doing very well. Could rate it to be maybe 6 to 10. And in the industry, the ISO is actually, it depends with the industry, with industry, which ISO you're talking about. But average, they would say in Kenya, the ISO certifications, Kenyans is doing very well with accrediting organization. And I would say in a scale of 8 to 10.
All right. Thank you very much. I hope that answers your question, Marin. Yes, Ibrahim, you have a hand. May you please unmute and speak?
All right. Thank you, Mr. Philip, for the interview and minutes. So my question is, how is a person, is it possible for a person to apply for a certification with the ISO?
You first of all, by the time you're going to apply for certification, you must have started implementing the ISO, which means if you want to do ISO 17025, you will buy the standard, you will train on the standard, then you will build the laboratory, you will buy the equipment, and you decide on which parameters do you want to be certified on. So after you've identified those parameters and you train people on those parameters, then Kenyans will come. You will apply for accreditation. So Kenyans will come in Kenya, or an accreditation services organization will come and will work with you in the process of how you're doing things until the end. So if you don't have non-conformity, then you will get an accreditation certificate.
Okay, sorry. So it's based on the country, because me, I'm in Nigeria.
Yeah, that's the process, even if you're in Nigeria.
Thank you very much, Ibrahim, for that question. Engineer Philip, apologies, but there are a lot of questions in the chat. I'll just be reading for you. There's another question from Marin again. She's saying, are there any penalties for being an ISO or IEC certified? Are there any penalties for not being ISO or IEC certified?
Penalties. They withdraw accreditation. They withdraw certification, and therefore now many organizations will not have confidence in you. Yeah.
Marin, does that answer your question? Please give me a thumbs up if it does.
Yeah, it does. Thank you.
Yeah.
Thank you very much. There's another question
Mm.
from Ronald. He is asking, how is the CMMS different from SAP and LOIMS systems? Of course, in this case, I'm not so sure, Ronald, what you mean by SAP and LOIMS systems, but that's a question. We'd like to get an insight on the differences between these three.
I think you need to tell us more about those two.
Ronald, may you please expatiate on the abbreviations for SAP and LOIMS systems? As you are doing that, there is a question from Abib. He is asking, is there any free CMMS that can anyone use or anyone uses? Like that, the system that would be for free of access, maybe the one that you have used or the one that you know for now, Engineer Philip.
I've not used of any. I don't know of any that is free, but there are some open platforms. There's a time when International Federation of Biological and Medical Engineering had one, which was an open platform. But I think I cannot remember it now because that was a long time ago. I can follow up and maybe if I get it, I can share.
All right, thank you very much.
Yeah.
Any questions from the audience? If you have any questions, you may just raise your hand. For those who just joined late, this recording will be available on the BMA Kwanzaa app and also on the Oxygen Alliance YouTube channel. If you have any question or comments based on this presentation, you are free to raise your hand. Yes, Ronald, over to you.
Thank you so much. Can you hear me?
Yes.
Yeah, good evening to you all, coming from Uganda.
Yeah.
Yeah, so about CMS, CMMS, and SFP. SFP is system applications and products, major used in data processing, and LIMS is laboratory information management systems that we use in analytical laboratories, right, for also maintenance and also analysis in the laboratories. SAP majorly we also use for maintenance, managing breakdowns, purchase requisitions of spares. So that's my question was, is there any difference between CMMS and these two that I've mentioned? Thank you.
All of them are computerized management system, although but they have limitations. I know of the laboratory one because it is dealing with purely laboratory equipment and all other things, because I remember when I was implementing a program, implementing ISO 17025 in Kenya, we used that platform, and it is mainly for laboratory equipment, and it does not give you a lot of details about what you have done on equipment. It just shows that you have done the maintenance, but now when you go back to the history of equipment, it will not be able to give you that. But when you talk about the CMMS, it is for a complete hospital. It will give you the inventory of the entire hospital equipment and hospital medical devices and hospital equipment. And in fact, you can as well use it for facilities management.
Thank you very much, Engineer Philip. Lloyd, I think you also have a comment on this. May you please unmute and speak?
Yeah, just to add, sorry, let me just fix my audio. Yeah, just to add on what Engineer Philip has said, I would want to say that you should view the same MS and the RIM system as different systems, because the RIM system is mainly used for tracking the workforce or maybe improving the workforce around the laboratory itself. So in the lab they are used to collect tests, giving the results. So the RIM system is much more focused around that, while the computerized maintenance management system is more about now the equipment, the medical equipment itself, like now managing the maintenance scheduling of those equipments, asset tracking of those equipments, even the work order management to reduce downtime of an equipment. So there are actually different systems. Yeah, that's what I would add on as well.
Thank you, Lloyd.
Thank you very much, Lloyd. I have seen Lloyd and Engineer Philip. I think, Ronald, that answers your question. If it answers the question, may you please give me a thumbs up. If it doesn't, just write your email so that we can also reach out to you maybe after this webinar. We can just do like a follow-up. For Navel, you are asking that it's your first time joining the Oxen Alliance webinars. Normally, if you want to get updates from the Oxen Alliance due to the webinars that we do, you can just type your email in the chat and we'll reach out to you and we'll make sure that we send the invitations for upcoming events and webinars. So please just write your email in the chat. And also, if you would want to get any communications from the Oxen Alliance, you can reach out to us on the info@oxenalliance.org as it is written in the presentation, as it is showing in the presentation. And also you can also check more about the Oxen Alliance through our website on the www.oxenalliance.org. So whatever you need to know about the Oxen Alliance, the communications, you can reach out through that. For the technical questions, if you have any questions, please use the BME Kwanza app, or you can actually just reach out through the help desk platform. But mainly currently we're using the BME Kwanza app. There is another question. This will be our last question before we close the call. So Chantel is asking, assuming I run a BME company or hospital, does that mean I need to adhere to both ISO 13485, 14971, and 9001? Or does ISO 13485 cover the whole healthcare technology management cycle of a device? I'll read that question again. Assuming I run a BME company or a hospital, does that mean I need to adhere to these three ISO standards? So he or she has mentioned ISO 13485, 14971, and 9001. Does the person have to adhere to all these three, or does the person have to adhere to ISO 13485, which is more like covering the whole HTM cycle of a device? Engineer Philip, over to you.
You can, if you are having 13485, it will be able to cover you to run the medical devices. You know, ISO 9001 is just to help you and get the process running. And even those other processes, you can also have them onto the other one. Those other ISO complement the ISO for risk management. They complement ISO 134. Like when we talk about the one talk on risk of medical equipment, that one also, it is not covered. It does not covered seriously on 13485. Yeah, but it's not, if you're having the other one, it can still cover, but there are some other areas which it does not cover. But it's not a must that you must have all of them.
Thank you very much, Engineer Philip. Thanks, Chantel. I've seen your hand, and I hope that answers your question. To our audience, thank you for joining this call. Engineer Philip, maybe before we close, do you have any closing remarks to the audience today, our engineers and technicians who just joined for today's webinar?
I would wish to tell my biomedical colleagues that we try to embrace the ISO standards, particularly 13485 and 17025. I know it is expensive to implement, but that will give us a lot of credibility in our services. Have a nice time.
Thank you very much, Engineer Philip. Thanks.
Thank you very much, everybody, for your time.
Sure. Thanks, everyone, for joining the call out of your busy schedules. We appreciate the fact that you joined, and we are hoping to see you in the next webinars. Let me point it out to everyone that we are about to close this theme of medical equipment management, and we'll be going into a different theme, which will be covering panel discussions. So we'll have a couple of panel discussions on procurement of medical equipment, on how you can manage donated equipment, on also how you can also work with the CMMS that was being talked about here. We'll talk about it in detail, and also we'll be looking at telemedicine. So I think from October to November, these are the topics that are being planned, and there'll be panel discussions with specialists across the region and people who have diversity of experience in the biomedical engineering and also other sectors. So if you need to get communications, like I said, type your email in the chat. And the last webinar that will be coming next week, Thursday, will be on electrosurgical units, and this will be covered by Dr. Robert. He is based in Uganda. I would like to see everyone there, and have a nice day. Bye to everyone.
Thank you so much. Enjoy yourself.
Thank you.
If you have comments and/or questions, drop them in the comment section below or write to us info@oxygenalliance.org. Remember to like our videos, subscribe to our channel, and hit the notification bell.